So Fox 40 is still honoring Black History Month, and this year it's never been more important to focus on health and wellness. This is extremely vital within the Black community. So Laviola Ward is a mental health counselor with the Stop Stigma Speakers Bureau, and she's talking to us about this very specific issue that's happening within our Black community. Thank you so much for joining us and talking about this.
Sure. Thank you for having me.
So the question that I want to ask is, is there a stigma within the Black community about seeking mental health care? And if so, why is that here, and why has that been a thing here?
Absolutely, there is a stigma that exists. I think Black people, we have been touted in our community for resilience and strength. And in many cases, that has meant that we are not allowed to be, weak or show that we're having trouble. Mental health is definitely viewed as a weakness or a problem within our community. And sometimes it's tough to go and face that and get help when we're having mental struggles.
Yes, and I was going to say, in over years of adversity, struggling with racism and civil rights,
Sure.
and it's like we've built up this hard shell. We don't need help, but
Absolutely.
we absolutely do, and there's nothing wrong with getting that. A study recently by Mental Health America found suicidal thoughts and plans of attempted suicide are rising among young Black adults. So do you think
Sure.
this is based on situational or environmental circumstances?
I think it's a combination of both. I think we are in unprecedented times. We've had a pandemic, we've had publicized racial division, and it's weighing a lot on our youth and within our community. We're in an environment where we can access any information at any time on our phones, and there's a lot to carry in addition to the mental health issues we may struggle with genetically or, there's just a combination of things that make it a really tough time, especially for our young people.
Absolutely. And this is no real big shock, but socioeconomic status is obviously linked to mental health in a lot of circumstances. People who are impoverished, homeless,
Yeah.
or incarcerated, who have substance abuse issues, they have a higher risk of having poor mental health. And we see
Sure.
that all the time with these poor Black neighborhoods. So I wonder what you or your organization is doing to sort of help, let's get this done. Let's help kind of target those areas and target this massive issue.
Sure. I think access is the biggest issue. People may not have health insurance. People may not be aware of resources that are available to them. And I think Stop Stigma Sacramento does such a tremendous job of going out into the community, meeting people where they're at, going and giving talks. We're educating people, and we're showing people, where resources are, how they can get access to healthcare, even if they may not have insurance. There's, numbers they can call 24 hours a day. We really want to keep that conversation going and educate about what's available to people.
And do you think our city and state leaders, they can do more in targeting the mental health crisis within the Black community?
I think that's a heavy question. I think there always can be more to be done within our communities. I think a lot of outreach. I think more representation is necessary so that people can feel understood when they're getting mental health care. But I do think that our county is making a just effort, even with this program, by ensuring that programs like this are maintained so that people do have access and have available resources. There always can be more, but I am proud of what we're doing.
Absolutely, absolutely. And Ms. Ward, how do we get in touch with your organization, or where can we find more information about the programs and different outlets that you guys offer?
Sure. The stopstigmasacramento.org, I think, is the best resource. It's the website. It's the home base for our program. People can sign up to be speakers. People can request speakers. You can get referred to, different crisis hotlines and all sorts of resources within our area. I would definitely go to the website as a kind of a one-stop shop for help.
Absolutely. Thank you so much for joining us. Again, there's nothing wrong with getting help and asking for help. So thank you for pushing that narrative. We appreciate you this morning.
Thank you for having me.
Of course. Okay, take